Hi friends, welcome back to Medico Experts channel, your trusted source for health and wellness information. Today, we are covering an important topic, which is pancreatic cancer causes and risk factors. Pancreatic cancer happens when tumors form in your pancreas. What causes pancreatic cancer? Pancreatic cancer happens when DNA in a cell in your pancreas is damaged. A single cancer cell grows and divides rapidly, becoming a tumor that doesn't go along with your body's usual boundaries. Without treatment, cells from the tumor spread through your blood or lymph system. No one knows exactly how the cell's DNA is damaged. When doctors remove pancreatic cancers and analyze them, they usually find certain changes in genes called mutations. Other times, the mutations vary between people. Inherited gene mutations. Your parents can pass along mutations that make you more likely to get pancreatic cancer. Doctors have linked the condition to the BRCA1 and BRCA2 genes, as well as genes that cause colorectal cancer and other health problems. These mutations cause up to 10% of pancreatic cancer cases. Acquired gene mutations. Many gene changes happen after you're born. Sometimes, they change because you come into contact with chemicals like those in tobacco smoke. Other mutations happen at random as your cells copy your DNA and divide. Let's move on to the risk factors. Pancreatic cancer risk factors. About 1 in 64 people will develop pancreatic cancer. This is the average risk. Any of these things can increase your risk. Risk factor 1, age. Your risk goes up as you get older. Over 80% of cases are in people between 60 and 80 years old. Risk factor 2, genetics. 5% to 10% of people with pancreatic cancer have a close family member who also had it. Risk factor 3, diabetes. Most of this risk is in people who have type 2 diabetes. Risk factor 4, smoking. The more you smoke, the higher your risk. But 10 years after you quit, you have the same risk as someone who never smoked. Risk factor 6, obesity and inactivity. In a study of 88,000 nurses, those who had a body mass index, BMI, a measure of your height compared to your weight, higher than 30 were more likely to develop pancreatic cancer. Those who exercised often were about half as likely to get pancreatic cancer as those who got no exercise at all. Risk factor 7, gender. Men have a higher pancreatic cancer risk than women, possibly because they're also more likely to smoke. Risk factor 8, chronic pancreatitis. Heavy alcohol and tobacco use often cause this long-term inflammation. Risk factor 8, high-fat diet. Some studies have linked pancreatic cancer to a diet high in fat and meat, especially smoked or processed meat. In other research, people lowered their risk by eating a healthy diet with lots of fruits and vegetables. Risk factor 9, lycopene and selenium. Studies have found that some people with pancreatic cancer had low levels of these nutrients. But there's no definite link. You can get lycopene and selenium by eating lean meat and red or yellow vegetables. Risk factor 10, chemical exposure. Your risk might be higher if you work in the metalworking or dry cleaning industries and have contact with a lot of chemicals. Getting rid of your risk factors for pancreatic cancer doesn't mean you'll never get it. But eating a healthy diet, keeping a healthy weight, and exercising often will improve your overall health and lower your risk of other problems. Thank you for joining us today on the Medico Experts channel. Stay informed, stay healthy, and we'll see you next video.